Now I'd like to talk about the use of sauna to increase growth hormone. Growth hormone is a hormone that we all naturally secrete from our pituitary, which also resides near the roof of our mouth. The signal for the pituitary to release growth hormone arrives from neurons that exist in the hypothalamus. So growth hormone releasing hormones, believe it or not, that's what they're called, stimulate the release of growth hormone from the anterior pituitary gland into the general circulation. And then growth hormone impacts metabolism and growth of cells and tissues of the body. It is responsible for tissue repair as well. And the growth spurt that everyone experiences during puberty is the consequence of growth hormone. What I'm about to describe is a study that found dramatic, really dramatic, I should say, increases in growth hormone. But I also want to emphasize that these increases in growth hormone were not of the sort that are observed in puberty or in infants becoming adolescents or adolescents growing into teenagers. Those levels of growth hormone that are associated with those massive transformations, of body morphology, of shape, are far greater than the sorts that I'm talking about here. And yet, as all of us age, when we go from adolescence to our teenage years and then into young adulthood, but then starting in our early 30s or so, the amount of growth hormone that we secrete is greatly diminished. Normally, we would release growth hormone every night after we go to sleep, in particular in the early part of the night when our sleep is comprised mostly of slow wave sleep. As we age, less growth hormone is released during that slow wave sleep. There are various things that can promote the release of growth hormone, and we will talk about some of those other things in a moment. Things like low blood sugar, turns out, is a stimulus for growth hormone release. And I don't mean hypoglycemia of the sort that makes you dizzy and want to pass out. That's bad. I mean not having high levels of glucose and insulin in your bloodstream. This is one of the reasons why many people are drawn to intermittent fasting or even prolonged fasting. It's because of the reported increases in growth hormone. I'll touch on those briefly, but if you want to learn more about those and what their real impact is and the extent of growth hormone, check out the episode I did on fasting. You can find that at hubermanlab.com. Certain forms of exercise have also been shown to stimulate growth hormone release. And in a few moments, I'll talk about how exercise and fasting can be combined, or how heat can be combined with exercise or certain patterns of food intake to further increase growth hormone. But before I do that, I want to review some of the data, and one study in particular that discovered certain forms of deliberate heat exposure using sauna can stimulate very large increases in growth hormone output, which for people in their 30s, 40s, and beyond could be very useful, and may also be useful for people who are just trying to stimulate the release of more growth hormone in order to, for instance, recover from exercise or stimulate fat loss or muscle growth or repair of a particular injury. The title of this paper is Endocrine Effects of Repeated Sauna Bathing. And this is a paper that was published in 1986, which is some years ago, but nonetheless serves as a basis for a lot of other studies that followed. So let me describe what they did in this study. They used an 80 degrees Celsius environment, so that's 176 degrees Fahrenheit, and they had subjects do this sauna for 30 minutes 4 times per day. So that's 2 hours total in one day. 30 minutes in the sauna, a period of cool down rest, 30 minutes in the sauna again, cool down rest, a third and a fourth time. Okay, so 2 hours total in this 80 degrees Celsius environment. So that's a lot, but what they observed was really quite significant. So they had subjects do this protocol, and I should mention they had both male and female subjects in this study. And the entire study lasted a week. They did this 2 hours of sauna exposure on day 1, day 3, and day 7 of that week. And they measured a lot of different hormones: cortisol, thyroid stimulating hormone, thyroid hormone itself, luteinizing hormone, and follicle stimulating hormone, which are hormones that essentially drive the production of other hormones. We won't get into that too deeply, but if you'd like to learn about FSH, follicle stimulating hormone, and luteinizing hormone, please see the episode on optimizing testosterone and estrogen at hubermanlab.com. They looked at prolactin and they looked at growth hormone. I'll just cut to the chase and tell you the effects on growth hormone. In subjects that did this 2 hour a day, 80 degree Celsius protocol, experienced 16-fold increases in growth hormone. So they measured growth hormone before the sauna and after the sauna, and growth hormone levels went up 16-fold, which is obviously an enormous and, it turns out, statistically significant effect. Now, one important caveat here. Remember earlier when I talked about people who did sauna once a week versus 2 to 3 times a week versus 4 to 7 times a week, and the more often people did sauna, the less likely they were to die of cardiovascular events or other things of that sort? Well, in this case, the effects of sauna exposure on growth hormone actually went down the more often that people did this deliberate heat exposure. So as I mentioned, they did this 2-hour a day, divided into 30-minute sessions protocol on day 1, day 3, and day 7 of a week. And what they found was on day 1, there was a 16-fold increase in growth hormone. On day 3, however, there was still a significant effect on growth hormone as compared to before sauna, but that effect was basically cut by 2/3. Okay, so now instead of getting a 16-fold increase, it was more like a 3 or 4-fold increase, which is still a huge increase, but not as great as the increase observed on day 1. And then on day 7, there tended to be a 2, maybe a 3-fold increase, but not as great as the one observed on day 1. What does this mean and why does this happen? Well, the reason this happens is because heat, just like cold, is a shock or a stressor to the system. In the context of cold, if you get into a very cold ice bath, for instance, a 5-degree ice bath, even for 20 seconds, it's known to increase norepinephrine 200%. It can double the amount of norepinephrine that you suddenly release into your brain and body, which actually can have some positive effects. I'll talk about those in a little bit. But if you were to do that every day, you would become cold adapted. This circuit that compares the shell and core of your body would adjust in ways that it could either predict that cold stimulus or more likely to create some thermogenic mechanisms in preparation for that cold exposure. This is why, for instance, people that use deliberate cold exposure to try and increase lipolysis, the burning of fat, oftentimes will get results for a while, but then if they're doing it a lot, they stop getting those effects. I talk a lot about avoiding cold adaptation if that's your goal in the episode on cold. But similar mechanisms are at play here. So we have to imagine that when these subjects got into the sauna on day 1, whatever pathways went from measurement of temperature at the shell to changes in temperature at the core led to these big increases in growth hormone, which is basically a way of just describing the result I already told you before. But the fact that that result diminished over time either means that the circuit was not as efficient in communicating that shift in temperature, or that that shift in temperature was of less impact because the downstream effectors were not engaged to the same extent because it wasn't as much of a shock. And I think the latter explanation is far more likely. This is very much akin to weight training or cardiovascular exercise, where if you run up a hill very fast, for instance, and your lungs are burning and you're heaving and breathing hard, on the first day, that's a very painful thing. But if you do it every day or every other day, provided you allow yourself to recover, pretty soon you're running up that hill and you're not breathing as hard. There isn't as much burning in your muscles, et cetera, et cetera. Your body adapts. So one of the key things to understand about the use of deliberate heat exposure is if you're going to use it in order to try and trigger massive increases in growth hormone, you're going to need to be careful about not doing it more than, let's say, once a week. Now, I'm extrapolating from this study. Maybe once every 10 days would be even better. But if you start getting heat adapted, it's very unlikely that you're going to get these massive increases in growth hormone. So I don't mean to be discouraging of using deliberate heat exposure to access growth hormone increases, but if that's your specific goal or your main goal, then I think it's reasonable to say that you don't want to do deliberate heat exposure, at least not of the sort that I described here, more than once a week or maybe even once every 10 days, and that you would want to time that to other events in your life, maybe hard workouts, or if you're trying to push through a fat loss barrier, or simply in order to access growth hormone at peak levels, maybe 3 times per month or 4 times per month. If you start doing deliberate heat exposure more often, you'll still get increases in growth hormone, but they are not going to be nearly as large as the increases in growth hormone that you're going to experience if you shock your system with deliberate heat exposure every once in a while. An important way to frame this is actually in the context of cold. And while you might say, wait, this is an episode on heat and heating, not cold, you really can't have a conversation about heat and heating without talking about cold, because as I mentioned earlier, if you cool the outside of your body, the shell, you're actually heating up your body. In fact, the circuits that control heating of the body and that control cooling of the body, for instance, the activation of things like shiver or fat loss in response to cold and shiver, those are also controlled by the preoptic area of the hypothalamus. So we can take a step back and start to think about what it would take to design the optimal protocol for deliberate heat exposure by looking at cold. And here's what I mean. There have been beautiful studies showing that if people get into a very cold body of water, 4 degrees Celsius for 20 seconds, as I mentioned earlier, that will cause a 200 to 300% increase in norepinephrine. Norepinephrine is also called noradrenaline, and norepinephrine and other so-called catecholamines like dopamine increase dramatically in this very brief cold water exposure. And those increases in norepinephrine and dopamine are known to have long-lasting effects that generally lead to improvements in mood, focus, and alertness. So they're pretty significant. However, they aren't significant enough to increase metabolism to a very high degree. Whereas other studies have shown that if people go outside in 16 degrees Celsius weather with a proper amount, but a fairly minimum amount of clothing, you can experience even greater increases in norepinephrine. But the time that's required in order to experience those increases is 6 hours at, for instance, 16 degrees Celsius. So if you have 6 hours a day to be out there in the cold, or if you can turn the air conditioning on in an environment, make it very, very cold, fine. But basically what I'm describing is that you can sort of bookend the parameters that you can use. You can use a very brief exposure to cold or to heat in order to stimulate heat shock proteins, growth hormone, etc. Or you can use longer exposure in less intense versions of heat and cold. You really have to find what's going to work for you and what you can do safely. And if you're confused about where to start, please use the parameters that I described earlier. First of all, check with your doctor, as always. Make sure that you're somebody who can do deliberate cold or heat exposure safely. But that 80 to 100 degrees Celsius, meaning 176 degrees Fahrenheit to 212 degrees Fahrenheit, that I keep repeating over and over because I know somebody's going to ask, even though I repeat it over and over, which is fine. I'm delighted to keep saying it and to respond if someone asks again. Well, those parameters are going to kind of bookend what you should do in terms of the intensity of the heat stimulus. How long? Well, we heard earlier, 5 to 20 minutes. Why not start with 5 and then ramp it up to 10 or 15? And then if you're feeling really bold and you really want to crank out growth hormone, well, then you could do that 30-minute, 4 times in one day stimulus every once in a while. So you have to really figure out what you're using heat exposure for. This is one of the reasons why when people say, is it better to get in a wet sauna or dry sauna? What's the optimal temperature? Is it better to take a hot shower, a hot bath, or a hot tub? To be completely honest, it depends on what you're going to be able to do regularly, whether or not you want to do it regularly, and what your specific goals are. So the purpose of this episode is really to arm you with the underlying mechanisms and to arm you with the general parameters that are going to allow you to access the results that you're seeking. For what it's worth, I personally use a protocol, and I've been using a protocol for a long time that involves trying, meaning I accomplish this most weeks, not all, trying to get into a sauna for 3 20-minute sessions every week. I use a dry sauna, so it's not a steam room. If I don't have access to it, I might take a hot bath or something of that sort. But in general, I just stick to doing the sauna 3 times a week. And I generally will do that either after a workout, either a cardiovascular workout or a weight workout, or I'll do it later in the evening. Why later in the evening? Well, it has to do with the circadian shifts in temperature that we all experience. Talked a lot about this in the circadian episodes and the episodes related to sleep, but in a nutshell, here's how it works. Every early morning, about 2 hours before your typical wake-up time, your body temperature is at its all-time lowest. Okay? We call that your temperature minimum. Right about waking, your body temperature increases. In fact, an increase in body temperature is part of the reason you wake up at all, unless, of course, you're setting an alarm. Increases in body temperature are going to be one of the major things that wakes up your brain and body. Body temperature will tend to continue to increase through the morning. You'll get that increase in cortisol. That's a healthy increase in cortisol. Body temperature will increase into the afternoon, and then will start to drop in the later afternoon. This general contour can be shifted by whether or not you exercise, how often you eat, because of the so-called thermogenic effects of food. That is, every time you eat, there's a slight increase in body temperature and metabolism, but it's not really that significant to throw off this general contour and rhythm. But toward the afternoon, around 4 or 5 o'clock, most days, depending on time of year, your body temperature will peak, and then it will start to drop, And as your body temperature drops by 1 to 3 degrees, and here I'm referring to your core body temperature, not your shell body temperature, you will start to get sleepy, and to transition into sleep and to maintain sleep throughout the night, your body temperature will remain low until you hit that temperature minimum, and then it'll start to come up again. Okay? What that means is that when you decide to do sauna, or cold exposure for that matter, is going to be important. Why? Well, as I mentioned earlier, if you were to make the surface of your body cold, at least in the immediate period after that, your body temperature will increase. So for those of you that are challenged in getting to sleep and are still working on your sleep, remember, sleep is the foundation of all mental and physical health and optimal performance. You should try to get really quality sleep of sufficient duration, at least 80% of nights. That should be an ongoing goal throughout your lifespan for a huge number of reasons. Watch the Master Sleep episode if you'd like to hear more of those reasons and the mechanisms to make sure that you do that. But in any event, cold exposure late in the evening will start to increase your body temperature again. And that can make it hard for some people to fall asleep. Now, if you're very, very tired because you've been working hard or training hard or both throughout the day, it might not throw off your sleep so much. I've gone through bouts where I'm just so busy from morning till night that the only time I can get into the ice bath or the cold shower is late in the evening, and I have no trouble sleeping after that. However, if you have trouble sleeping, I would recommend doing the cold exposure early in the day to match that natural heating, that natural increase in body temperature that occurs across the 24-hour so-called circadian rhythm. Similarly, if you're going to use deliberate heat exposure, you'd be wise to do that later in the day. You'd be wise to do it later in the day because when you get into a warm environment, sure, the surface of your body, the shell heats up, the core of your body heats up, but then it also activates cooling mechanisms through the preoptic area. And when you get out of that hot environment, sauna or otherwise, your body will continue to cool down. And so many people find that if they do sauna in the later half of the day or even just before sleep and then take a warmish shower afterwards, then they find it easier to fall asleep. And that makes sense because their body temperature is dropping. And in fact, if your goal is to really promote the maximum amount of growth hormone release, that's also going to be the best time of day to do it, especially if you haven't eaten in the 2 hours before sleep. Okay, so if you're really going for growth hormone release, you're really trying to optimize sleep, and the two things are actually linked because of the release of growth hormone that happens from the pituitary in the early night's sleep, well, then you would be wise to do your sauna maybe once or maybe twice a week in the evening or at nighttime, then taking a warm or cool shower just briefly, just enough to kind of rinse off all the sweat from the sauna, and then get ready for sleep. And to do that, not necessarily fasted, but to try and keep your levels of glucose and insulin somewhat low in your bloodstream. The reason I say that is that having elevated blood glucose and or insulin tends to blunt or reduce growth hormone release. And that's true for any number of different stimuli, including exercise and including sauna. So there's a really nice study on this that I can point you to. There's this study that was published in the journal Stress. Literally, that's the name of the journal. I love it when journals have these names like Pain or Stress. I find that somewhat amusing for reasons that escape me, but nonetheless amuse me. The title of this study is Growth Hormone Response to Different Consecutive Stress Stimuli in Healthy Men. Is there any difference? And I don't want to go into all the details of the study because it's pretty extensive and complicated. But basically what they did is that they had people do sauna and then gave them a drug or a condition of having low, not dangerously low, but low blood sugar. Or they had them in a condition where they had low blood sugar and then did sauna. Or they had them do an exercise protocol that led them to increase growth hormone and then had them do low blood sugar. Basically mixing and matching the various stimuli that could increase growth hormone. And what they found was very straightforward. What they found was that doing sauna once and then waiting some period of time and then later that day doing sauna again, they didn't see the same increase in growth hormone both times. First, they got a big increase in growth hormone and then less if they did sauna again. If they had people do exercise and then sauna, what they found was exercise could stimulate growth hormone, but then following it with sauna did not allow you to get twice as much growth hormone. In general, anytime you release growth hormone, you reduce the likelihood that you're going to release growth hormone again later that day. And this partially explains that earlier study where if people did this growth hormone promoting protocol on day 1, but then on day 3, they didn't see quite as big an effect, and on day 7, they didn't see quite as big an effect. all it basically boils down to is that if you really want to crank out the most amount of growth hormone in response to sauna, do it fasted, or at least not having ingested any food in the 2 or 3 hours before. You don't have to be deep into a fast. And the whole notion of what breaks a fast is kind of an interesting conversation because it's contextual, right? Will a sip of coffee break your fast? Well, maybe, probably not. Will 1 grain of sugar break your fast? No. Will an entire candy bar break your fast? Yes. It has to do with where your blood glucose is when you ingest that particular food item, not so much what that food item is per se. But the bottom line here is if you want to crank out the most amount of growth hormone, wait a couple of hours after eating before getting into the sauna. Or maybe do it before dinner and then prepare dinner, do the sauna before dinner, that is, then prepare dinner, then eat dinner, and then make sure that you wait a few hours before going to sleep. You're going to have to arrange your schedule accordingly. I know most people can't arrange their schedule perfectly just to get growth hormone increases, nor do I think people should approach health protocols that way. I think for 90% of people, 90% of the time, just getting into the sauna once or twice or 3 times a week is going to be beneficial for the number of reasons that I described earlier. And you don't want to obsess too much about the exact conditions you need in order to get the greatest effect out of that sauna treatment. These are just some additional tweaks related to food intake and low-level hypoglycemia and exercise that if you wanted to leverage, you could.